My name is Teresa Ching. I am a Conjoint Professor at NextSense Institute at Macquarie Park and Macquarie University in New South Wales in Australia. I'm also an Honorary Professor at the University of Queensland in Australia. I've started doing a PhD in phonetics and linguistics and then got interested in helping people with hearing loss. And subsequently, I was engaged in cochlear implant programs. I was working at the National Acoustic Laboratories, leading the pediatric research program there. And now I'm working with NextSense Institute as a professorial fellow. My area of research is in hearing rehabilitation for children who are deaf or hard of hearing. Now, many of these children have difficulties learning language and social skills, which limits their ability to achieve their full potentials in life. So by conducting population-based studies, I've worked with colleagues in trying to find out what are the factors that influence their developmental outcomes. The research findings have been taken up in practice and have been used to drive evidence-based management of childhood hearing loss. There remains, however, children from culturally and linguistically diverse backgrounds who are at a particular disadvantage and at high risk for language delays. So my current research focuses on devising culturally sensitive practices for intervention to enable these children to maximize their outcomes. Furthermore, we found that there are many children who start school who have a hearing loss that is undetected and untreated. And this will restrict their educational attainment and their social participation. So for this reason, I've worked with colleagues to work on culturally sensitive practices for intervention, and also to look at targeting guidelines and recommendations, and to develop these recommendations not only in Australia but globally around the world. And these recommendations focus on the use of hearing screening past the newborn period, with the ultimate goal that every child will have access to early detection and early intervention. My research has been funded by the National Institutes of Health in the United States, the NHMRC in Australia, the Parser Williams Foundation, and other philanthropic organizations. I have always been most interested in seeing research findings being taken up in practice and policy. And really, I found that working in the environments that I've worked in over the past years have made this possible. These environments have got their own service provision networks, and they're very supportive in adopting research evidence into driving evidence-based practice in management of childhood hearing loss. I think my interest revolves around my own research passion. I've always wanted to equip myself with new skills, new knowledge. I engage with stakeholders. I want to find out what the needs are. And ultimately, my ultimate goal would be that there is equity of access, there is equity of care, and there is equity of outcomes for all children who have hearing difficulties.